Now we can demonstrate how to use the meter dose inhaler. So the first thing that we're going to do is wash our hands. We're going to identify and gather our supplies. So we want to have our medication, our spacer, and we want to have our monthly medication record and parent authorization form. So we are going to compare our monthly medication form, monthly medication record, to our medication container. So we have for Joey Doe the Provenal inhaler, which is albuterol sulfate. It's 120 micrograms per inhalation. And we're going to give 1 to 2 puffs every 4 to 6 hours as needed for asthma symptoms. Compared to our monthly medication record, we have for Joey Doe the Provenal inhaler, 1 to 2 puffs every 4 to 6 hours as needed. And Jane Doe has authorized for us to administer to Joey Doe the Provenal inhaler, 1 to 2 puffs every 4 to 6 hours as needed, and it's an inhaled medication. So it's for asthma symptoms. So you want to make sure that you have your asthma action plan to guide your administration, and that's what that looks like. That needs to be signed by the child's doctor. So anyone who has an inhaler for asthma needs to have an asthma action plan. Possible side effects that should be noted: dizziness, headache, sore throat, cough, nausea, and a rash. All right, so we read our special instructions. So inhalers may need to be shaken before use, and so this one we'll just shake before we use it. And then we want to check the expiration date on the bottle. So this medication is not expired. We're going to ask an assistant to help Joey administer this medication, and we can do our second medication check. So we have our Provenal inhaler. It's albuterol sulfate, and it's 120 micrograms per inhalation, and we are to give 1 to 2 puffs every 4 to 6 hours as needed for asthma symptoms. So I want to point out one thing to note is every 4 to 6 hours, you want to make sure to note when the last time that it was given, so whether or not you're within that administration window. So we have our monthly medication record, which says Joey Doe. It's the Provenal inhaler. We're going to give 1 to 2 puffs every 4 to 6 hours as needed. And we have the parent authorization form signed for Joey Doe to have the Provenal inhaler for asthma symptoms, 1 to 2 puffs every 4 to 6 hours as needed. Okay, so we are going to take our medication and supplies to Joey. We're going to explain what we're going to do, and we are going to put on our gloves. Get another set of gloves. And we are going to just position Joey so he's sitting comfortably. And we're going to attach our spacer to our inhaler. So you take the cap off your inhaler and you insert it into the end of your spacer. And take the cap off the end of your spacer. Okay, and for a very young child, you're going to have them put their mouth on the end of the spacer, and you're going to have them inhale deeply while you compress. So you would say, okay, Joey, let's inhale on the count of 3. 1, 2, 3. Take a deep breath. Okay. For an older child, you're going to have the child place the spacer in their mouth, and you're going to instruct the child to depress the inhaler as they inhale slowly. And you're going to try and get them to hold their breath for about 10 seconds. So you're going to say, Joey, can you take your spacer and you're going to compress your medication on the count of 3. 1, 2, 3. Take a deep breath. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then according to the asthma action plan, you're going to repeat those steps if needed. So we can detach our inhaler, put our cap back on. We're going to remove our gloves. We're going to wash our hands. I'm going to document that I gave Joey 1 puff of his inhaler, and we'll say at 2 o'clock in the afternoon. And we're going to document the symptoms that he had, and then also how they resolved. So we can return our spacer and our medication to our lockbox. We're going to clean our medication administration area. And we're going to observe Joey for any of the adverse side effects.